So we'll be talking about another medical condition, and funny enough, back to my anatomy days in the medical school. Yeah, we did pelvis, but I didn't actually even come across this concept. All right, so that's why they say you learn every day. Okay, it was when I was trying to learn about what inguinal hernias, femoral hernias, in my senior class. Okay, that was when I came across Psoas Abscess as a differential for inguinal hernia. So I was like, wow, okay, let me go do some research on this. So Psoas Abscess. Talking about this Psoas Abscess, we'll define it. We'll talk about the possible causes. We'll talk about the symptoms, right? We'll talk about the diagnosis. Like, how can you be able to what? Confirm that this medical condition actually exists. They will talk about what? The possible treatments for it. Alright. So for Psoas abscess now, for the definition, we said that Psoas abscess is actually rare, but a serious condition where an abscess, that's what, a collection of pores. Okay? Collection of pores will form in the psoas muscle or surrounding tissue. Okay? And it is usually caused by what? A bacterial infection. Alright? Bacterial infections. Another cause could be that maybe there's reduced blood supply to the muscle, so there's ischemia, death of tissues, so it actually led to what? Pus formation. This pus collected, formed abscess. Alright? But the most common cause is what? Bacterial infection. So talking about these bacterial infections, let's talk about the possible origins of these bacterial infections. It could be from the gastrointestinal tract that actually spread to the psoas muscle, right? Like from infections like what? Diverticulitis or appendicitis. It spread to that region. It could be urinary tract infections, still tracked up into the psoas muscle. It could be skin infections like cellulitis, tracked back into the psoas muscle. It could be bloodstream infections like what? Sepsis. The bacteria actually got into the bloodstream and is now spreading wide around your body. Alright. It could be some infected prosthetic devices like hip replacement. Then some complications came up after the surgery was done and all that. Alright. So talking about the possible symptoms of this disease condition, that's Psoas abscess. Come on, can you see this side is red? I didn't actually explain this. Can you see this side is white? That's to show that there's collection of pores right here. So there's heavy collection of pores in the psoas muscle, right? That's Psoas abscess. Symptoms: it could result into what? Pain in the lower back, groin, and thigh. It could result into fever and chills. There could be swelling and tenderness in the affected area. Okay, when you palpate, you feel that the patient can scream. All right, know that there's an abscess collection in the psoas. Then there will be limited mobility. Of course, the person will not really want to move the hips and thighs like that. Then there will be abdominal pain or guarding. All right, abdominal pain or guarding is like the patient don't really want you. They are guarding the place. All right. There could be nausea and vomiting. Alright. The diagnosis. Of course, the psoas muscle is buried deep down there. Alright. So you might want to do some imaging studies like CT scan, MRI scan, just to look at the what? Pus collection. Alright. Then you might also want to do some blood cultures just to see if there's a presence of what? Infection. Or if there's an infection, you see microorganisms in the blood and all that. Alright. Then you also do some physical examination. Because the area will be looking tender. When you touch it, the patient will feel so much pain. There'll be redness, there'll be swelling around that side. Do you understand? So you do physical examination is so important too. Then treatment. Since you are saying that the most common cause is bacterial infections, you might want to give antibiotics. It could be intravenous, it could be oral. Okay. Then you drain the abscess. Okay, it could be surgical or percutaneous, which you are just putting the drain through the skin. Okay, there's supportive care like pain management, hydrations. Okay, Then you also would keep monitoring the patients for possible complications like either sepsis or organ failure due to it. Alright, so guys, that's it about the psoas abscess from the definition, causes, symptoms, diagnosis, treatment. Alright, that's it. See you guys pretty soon.